Hello, everybody. Welcome to this episode of About Time with me, Chris Nichols. As you know, this is a series where I get the opportunity to talk to people I've known over the last 20, 25 years or so, people who've inspired me, influenced me, and been woven into the fabric of my life and work. And I am utterly delighted that today we're joined by Cedi Frederick, who's an absolute legend and one of the best leaders I know. I'm so chuffed you're here, Cedi. It's good to
Oh,
see you.
thank you so much, Chris. And I'm absolutely delighted to have been invited to spend some time with you, just chatting through life, the universe, and everything.
As we often have done. Um, Tell me, you do so many things. How on earth do you go about introducing yourself these days?
Uh, um, well, one of the things that I've reflected on, and I've learnt over my career, is actually I'm more than just what I do. So oftentimes I describe myself, Chris, as a son of Windrush, and my parents' journey and their influence on myself and my two siblings have really shaped how I see myself, the contribution that I want to make, and to a degree the professional path I have taken in my now 45 plus years of working life. So by way of background, my father came to London in 1955, and he came because the island of Grenada, a small island in the Caribbean, had been hit by a massive hurricane, Hurricane Janet, and at the same time, which you'll be aware of, there was a real call for people to come to England to contribute to a post-war effort, so to speak, and rebuilding and developing and so on and so forth. So both things came together. And this was at a time, of course, before the internet and Google. So it was a real adventure. It took weeks on what was a cargo ship that had some passengers on. And so my father came and moved into a single room in a shared house in South London. My mother came 6 months later, after he had settled and found his first job. So, and I was born 18 months or so after they arrived. So I was born and brought up in that single room in a shared house with an outside toilet. And that's where I started life. And the fact that my parents came to this country to serve, I think has really shaped how I've thought about life ever since. And I know that my siblings are of a similar mind. So in terms of what that has now led to, I have now the honour of chairing NHS Kenton Medway, which is one of the 42 integrated care boards in the country. I also chair and co-chair a number of organisations that are in the field of reducing health inequalities, in particular around Black African and Black Caribbean communities, but equally more widely in the field of research and development. I also sit on a number of boards. So I sit on the board of a housing company called Sage Homes. And what's different about Sage Homes is they're privately owned. So they're owned by Blackstone, a well-known venture capitalist company, and a smaller entity called Regis. That's Regis, not the office people.
Okay, yeah.
Until recently, I was on the board of a real estate investment trust. So I was able to gain some listed company knowledge and understanding. And I have what I call my passion projects. So in 2021, I co-founded and now CEO of a health tech startup. And our mission, put simply, is to save millions of lives in the developing world. And so we're working in that space. And I do lots of other things. I've got a small consultancy. I do a lot of coaching and mentoring, and so on and so forth. So I do lots of different things. I'm very, very lucky, Chris.
That's like an awesome list of stuff. Do you have any free time?
I do. And I'm extraordinarily blessed to have a wonderful family. So I've been married to Sue for 46 years. We have two sons. Tom is 44. Chris is 42. I am Pops. I refuse to be called Granddad or whatever. I'm Pops to four, forgive me, wonderful grandchildren ranging from 18 down to 4. So
Wow.
very, very blessed. Yes, indeed.
Yeah, that's brilliant. So we were trying to remember when we first got on Zoom before we hit record, just when we met, and we think it's a quarter of a century, more or less. And it was Ashridge, wasn't it?
It was. At the time, I was interesting. I was the chief executive of what was then described as a BME housing association. So a housing association that had been explicitly set up and established, as many were at that time, to try and rebalance what had been a housing deficit, public sector housing deficit, experienced by ethnic minority communities. And I'd been working in housing all of my career, so the best part of 20 years at that point in time. And I'm not quite sure how I got onto the course, but it was a 3-week long strategic leadership program. And I think it's fair to say, Chris, that program and the people that I met fundamentally changed my life. It changed my professional direction because I then transitioned away from housing to work in social care and became chief executive of a not-for-profit provider of support to people with learning disabilities, autism, and mental health problems. And then I went on to run an organization that supported people with dementia. So we had a portfolio initially of 19 care homes, and we supported people in their own homes, did lots of other things in that space. So the Ashridge experience and the people that I met, including yourself and Philippa Hardman,
was it Megan as well?
Megan Reeds,
yes,
George Binney,
yes,
Sarah Painter, or Sarah, that name ring a bell? Sarah Painter?
There are several Sarahs, so I'm not sure which one was involved in ACEVO. I think even Eve Poole might have been involved at some point, although she may have come on later in ACEVO than that first one.
Yes. And for colleagues who may not know what ACEVO was, it was the Association of Chief Executives of Voluntary Organizations. So it was an umbrella/trade body for chief executives of charities and non-profits, and they did a lot of work in trying to develop leadership in a sector that hadn't been historically known, perhaps, for great leadership. That was quite controversial, but there was certainly encouraging us as leaders to really start to think much more strategically, understand our place in the wider world, and the 3-week strategic leadership program really helped me rethink.
Yeah, that's wonderful. And, I have to say, it wasn't like right away on that program, but we stayed in touch. And I was developing at the time something that I called relational strategy. Because I was very dissatisfied with the thinking of strategy as military battles or, must-win battles and all of this kind of thing. And I thought, well, what if we just say, if strategy is about relationships, if we took that seriously? And I came up with a model called the four-sided triangle, which I wrote up once and then promptly forgot about. And years later, I discovered that you had taken it and done so much more with it than I ever, I ever did. And I was so grateful to you for like everything you did, because you wove relational work and relational strategy into everything you did for years and years.
It became that piece of work, Chris.
Yeah.
I went into an organization, as I mentioned, after leaving the world of housing, going into social care.
Mm.
I joined an organization that was 6 months from going out of business, effectively. And I was tasked with saving the organization and then building the organization. And I was there for 12 years. And we went from an organization with a turnover of £2 million a year and a bit of a running deficit to an organization that was around 30 million a year in terms of income. But bizarrely and not surprisingly, perhaps, our financial position was probably no stronger than it was when I first joined, but for many other reasons about fee levels and so on and so forth. So I went into an organization that I had the opportunity to build from the ground up, because people there were desperate to be led. So the sense of followership was there, and I very quickly realized that when you work in social care, you are working in human services. We were not there to make widgets. We were not there to, write long reports and so on and so forth. We were there to work with some of the most vulnerable people in our society. So I developed a vision, I guess, for an organization that would be built on relationships. Because when you are talking about the culture that you need in and with teams of people whose sole job is to support vulnerable people, it can't be based on, the Sandhurst model, for example, or what the leadership you might learn from West Point in America and so on and so forth. You need a very different way of being and of working. And that four-sided triangle in terms of the relationship with money, the relationship with the people you're here to serve, the relationship with the planet, and the relationship with strategy development were absolutely fundamental. And what that led to was, I think at the time, a very unique culture, and one that drew people to want to work with us. People left other organizations to come and join us. I remember we appointed an HR manager, and he'd built his career working in the construction industry. Now, this chap was gay, but he could not be himself working in that construction type culture. And I think it was on his first week, I went to see him and asked him how he's getting on. And he said, finally, I can be myself in this organization. It is very, very clear. The organization that we have here allows me to be myself, because it's not about my sexuality. It's all about relationships.
Yeah.
It's all about mutual support. It's all about challenge. And it's been a lot of work and thinking about the importance of cognitive diversity in teams, and all about that. So he was able to bring his whole self into work to contribute to making us a great organization. And I then went on to use that model in my subsequent chief executive roles, again, working in social care, in human services organizations. And it works, Chris. I mean, I don't know whether what you wrote at the time, you thought, actually, this is interesting. I'm not sure where it sits. But it absolutely shaped the organizations that I ran for the best part of 20 years.
Yeah, that's brilliant to know. I mean, I knew it worked, not because of anything that I'd done particularly, but because of, it's got deep roots in all of the humanistic psychology and the relational practice and feminist theories of leadership. there's work, miles deep on why this works. It's just nobody had ever applied it to strategy and strategic leadership. So I cooked up a little model to say, well, what if we did it like this? And I'm, and well, you know me, I'm not really an academic as such, so I haven't written books and Harvard Business Review articles. So it kind of just went, oh, well, there it is, play with it. And
Absolutely.
you
I
took
did.
it really seriously, and it's been brilliant to watch.
I did. It's interesting. It just goes to show, because when you talked about relationship with the planet and sustainability,
Yeah,
you were ahead of your time, and organizations are still wrestling with their relationship with the planet, and how that should be driving in a meaningful way their strategic thinking, um, and the benefits to their bottom line. I think there's still some way to go in that space, but absolutely. So, as I said, you have been such an influence on me, and I think there have been many times where we've had the opportunity just to reconnect over the last 25 plus years, and I've taken away so much from our conversations, the opportunities that I've had to check in with you. So yes, it's been a great relationship.
yeah. So Cedi, I mean, I would love to. I mean, whilst I love having the focus on me and my work, marvelous. Actually, let's talk about something that's uh, really important to you, which is all the work you do on health inequality and equality of access, equality of outcomes, because it was you who introduced me to just how vast some of those disparities are when you've been chairing health trusts. You said, just look at the difference between this community and this community. And I'm not sure that everybody listening to this will know. So could you say something about that? Because it's actually quite shocking and vitally important stuff.
It is, and if you think about the fact that we have a very diverse population, a very diverse country,
Hmm.
um, and we have inequality across all areas, economically, socially, and so on and so forth. One of the perhaps most underreported and under-considered areas of inequality is around health inequality.
Right.
And if you look, and let me start, I won't go into lots and lots of numbers and
Hmm.
details, but suffice to say that black women are 4 times more likely to die in childbirth than white women, for example.
Hmm.
And if you think about the impact of the disproportionate impact on black mental health relative to white people's mental health, for example, if you think about the difference and the impact of cardiovascular disease, these are all areas, and people will be aware that black men suffer greatly many more times than white men in terms of prostate cancer, for example, and things like that. Um, what brought it to, I think, national attention was the pandemic, of course. Now, I've been involved in the NHS, not as an employee, but as a non-executive director for many, many years, sitting on the board of different
Hmm.
um, health trusts. I was chair of a hospital trust in London, and I know that the NHS is awash with data and numbers and so on and so forth. At the time of the pandemic, I was chair at North Middlesex University Hospital,
Hmm.
which serves the boroughs of Enfield and Haringey in North London. Many people listening to this podcast will know those areas. As you would expect, given the magnitude of the pandemic, there was a lot of data captured,
Hmm.
and we soon started to realise and acknowledge the disproportionate impact of the pandemic on communities of color, so to speak. So I'm not just talking about Black African, Black Caribbean, but Bangladeshi, Pakistani, Indian subcontinent, and so on and so forth. And that led to all kinds of discussions about why that was. And of course, as we knew then, and we've done a lot of work on since, the impact of the pandemic disproportionately affected areas of deprivation. So you had multi-generational households, for example. You had people working in precarious occupations where if they didn't work, they didn't get paid.
Yes.
So COVID spread more rapidly across some of these communities. And being chair of an NHS hospital trust, where 64% of our 4,000 plus staff came from ethnic minority backgrounds, where the communities that we served came from those backgrounds, we saw at firsthand how disproportionate the impact was. I'm very lucky. I live out in leafy Hertfordshire, lovely garden. We spent a lot of time sitting in the garden. It was, and so on and so forth. But for many people, they didn't have that opportunity.
Yeah.
So, as chair of the trust, I felt compelled to be vocal about that impact. And as we were hurriedly moving into the world of online gatherings and so on and so forth, I spoke at many, many webinars and online events about the pandemic and how it's affecting communities of color.
Yeah.
If we roll forward to the vaccine rollout,
Yes.
it soon became very clear from the data that the level of take up of the vaccine was much, much lower amongst communities of color than the white population. There were white people literally queuing up around the building to be vaccinated. Black and brown people were not coming forward.
Yeah.
And the NHS was struggling at that point to understand the reasons why.
Yeah.
So they brought one or two people like me into the conversation to try and help them understand how to break through to these communities. Now, we do know that there were lots of WhatsApps going back and forth about Pfizer's involvement in Africa and things like that. So lots of myths were being circulated, but really those should not have led to thousands of people not coming forward. There's a real hesitancy. So we had to start thinking about how do we build trust in this community?
Yeah.
And I made the point in many meetings that what we were seeing wasn't just a lack of trust in the vaccine or the NHS, but it's a lack of trust across all institutions, whether that's the education system, the judicial system, the police, for example. And the NHS found itself in this space where there was a real lack of trust. So we had to start thinking about how do we build trust in those communities?
Yeah. Yeah.
And the best people to build trust are people that are well known in these particular communities. So we started talking about trusted people in trusted places. So, for example, a local pastor in a church, if he said to the congregation, "Well, I've had my vaccine, I think you should too, because it works, and I'm standing here," and so on, we saw the numbers of ethnic minority communities coming forward for their vaccines increase significantly. Same with imams and other faith leaders, but also community leaders, where they were local barbers, nail shop owners, shopkeepers. So we started a program to try and empower community champions to lead those conversations around the vaccine. And that's what started to see the numbers tick up in terms of communities coming forward. So that led to me being invited to join other discussions around. So we know that these communities are not coming forward for not just their vaccine, their COVID vaccine, but they're not coming forward for other vaccines. They're not coming forward for screening. They're not coming forward for immunization programs. So how do we use those principles that we had learned over the pandemic and turn those to try and increase the uptake of vaccines and immunizations and screening? I've been involved in that work ever since. And it really is about engaging with local communities.
Yeah,
It really, really
yeah,
is.
wonderful. And I mean, one of the things I love doing on these podcast conversations is just noticing the connections. And although you come from really different worlds, deep in healthcare, and the guy I was talking to a couple of days ago, Stephen Gould, was for many years managing director of Everard's, a brewing and pub owning company. At the heart of both of your stories of leadership is relationship and trust. And it's almost like you've met and worked together and developed a sense of leadership. And I don't think you have ever met,
No.
but um, what Everard's did was move from being an owner of lots of pubs. I think they still have pubs, but they turned their big city centre brewery into a community parkland and bike tracks and artisan coffee shops. And the whole thing was made possible because of, what did you say? Trusted people in trusted places. It's very, very similar. And I think that probably goes, there's probably hundreds of people listening to this who are going, and then that's how it worked for me too.
Absolutely.
Yeah.
And
So,
just to say, Chris, if I meant what we are seeing now, of course, more broadly and more widely, is a breakdown of trust in institutions. And where we saw perhaps through COVID and the pandemic, yes, there were people who were skeptical and so on and so forth, but generally speaking, the level of trust across the country was high, and we saw that in people's support of the NHS and the efforts they made to support the NHS through that difficult period. And whilst remaining completely apolitical, we are today seeing that trust being eroded, I think, more generally. And I think it's a real worry, I think. And I don't know how we as civic leaders can play our part to rebuild that trust.
Yeah. One of the connections I'd love to make is between your work and like John Alexander's work on, John Alexander wrote the book Citizens, Why the Answer to Everything is All of Us. And John I've talked to many times, and he's coming on the podcast in August. Very much about the connecting up of communities. And I think your work and his has a lot in common. And I think that it's the hard yards of connecting people up, difficult and slow though it can be, and many tides running in the other direction. But I think it's the only way. And I'm also thinking of Rob Hopkins' work. And Rob is, an imagination activist who his new book is How to Fall in Love with the Future. And I'm thinking there's something about the story of just what is possible if we get this right. And, I'm thinking so for you as a leader in healthcare and leading an integrated care board as a chair, you know, in 2030 or 2035, how good could this be if we get it right? And there must be positive stories about we're seeing things that are already happening that we could do much more of, and it could be brilliant by 5 years or 10 years time.
Yeah.
Yeah.
I think, Chris, you're absolutely right, of course, and I'm not an academic in that sense. I've written articles, and I've recently contributed a chapter to a book on leadership, which is going
Oh
to be
yeah, you're a proper writer now. That is a peer-reviewed chapter in a proper. You can't get off the hook. You are a writer.
But it is that sense, and I think one of the things that my background, I think, has given me, working in the wider public sector across a number of areas, including housing, including social care, the voluntary sector, and now with the various roles that I have in the NHS and elsewhere, is just how connected all of this is. I mean, what people don't understand, and I spend a lot of my time talking to people about this, is that only 20% of our health and well-being has anything to do with the NHS. 80% of our health and well-being are part of what we describe as the wider determinants of health.
Mm.
where you live, for example. And I saw in my housing career the impact, the multi-generational impact of poor housing on people's and families' physical and mental health, on relationships, and the impact that had on generations to come. Working across education, I was a governor of Canterbury Christchurch University for 8 years, and a number of opportunities to contribute to the educational sector. A big factor in terms of our life expectancy is the level of our education, where we live. And if you think about that, arguably, you think, of course it does. That must have an impact. If you live on the 17th floor of a tower block in an overcrowded, damp flat, compared to living in a 3-bed semi in one of the shires, that will have an impact.
Mm.
What will also have an impact, of course, is what you do for a job. Are you part of the precariat? You know, you're waiting for the phone for a few hours of work here, there, and everywhere, or have you built a career? And if you think about the impact that had on all of our lives, people have said to me, you know what? That's a light bulb moment for me. I can now understand why it's so important that as civic leaders we come together, we join up housing, education, employment, and we work much more collaboratively at what we call a place level to help local communities engage differently with civic institutions the best they possibly can, because it will have a positive impact on their health and the health of their children and the children to come.
Yeah. So, and I know you've positioned yourself, um, at the centre of what is a really political um, activity, which is, healthcare, which, health secretaries come and go, policies come and go. There's a reorganisation every 5 minutes. I mean, how do you survive? How do you stay there doing it?
Um, Let me share a story with you. I mentioned earlier, Chris, we have 2 sons, and our younger son, also called Chris, for many years worked in the city, um, and did very well financially and so on and so forth. And we were having Sunday lunch together, and he said to me, Dad, why is it your worst day at work is still better than my best day at work?
Ah,
And my response to Chris was, because, Chris, what I do matters. Now, I'm not suggesting that anyone who works in the city, the work they do does not matter. Of course not. But when you are positioned in front of a bank of computers and you're reacting to markets and so on and so forth, that's important work. Of course it is. But it's when you actually do something, you engage in something that brings you directly into contact with people. Why do people volunteer? Why do
yeah,
people who perhaps retired or whatever, why do they volunteer? Because they want to be closer to making a difference to somebody else. It comes back to relationships again.
mm,
And I've chosen, I've worked my entire career, including my non-executive director career, in the public sector, in the wider public sector, including the voluntary sector. I did some consultancy when I gave up full-time work for a private company, and I mentioned I sit on the board of privately owned companies and so on and so forth. So that's really interesting from my perspective. But I've chosen to dedicate my entire career to what I describe as making a positive difference.
yeah,
And when you are the chair of a social care provider, and
yeah,
you go into a care home for people with dementia, and you engage with the staff in that care home, many of whom are not particularly well paid, but the level of dedication is second to none. When you engage with people who previously were CEOs or leading academics and now have dementia, their world is very different now. Then you talk to their families. You know, it's an absolute honor to be engaged with families and individuals in this work, Chris. And you know on a day-to-day basis, what you are doing is making such a difference to that person's life directly. That's really uplifting, actually. It really
Yeah. Yeah, and I can see how that's a centrality of purpose and certainty that its useful work can help you to get through what must at times be, you know, kind of hair-tearingly frustrating organizational stuff and political stuff. Can integrated care boards really integrate systems? Is there still, because I know kind of things have come and gone on integrated care boards and what they're for. I mean, can it still happen, do you think? I mean, must it still happen?
Well, we're in a significant period of change, of course. The NHS is going through, I'm not sure when this is going out, Chris, but right now the NHS is going through significant change, and the future of integrated care boards being looked at again. Local authorities are going through, or will be going through, a major reorganisation, the like of which we haven't seen for decades, and that will change fundamentally how they work. But despite all of that, and I've said to colleagues in the local authorities, voluntary sector, and others that I speak to, the people we're here to serve, they don't care about all of that. So our job is to find a way to work collaboratively and collectively. It's very difficult because we all have different pots of money. We have different responsibilities in terms of statutes and legislation and so on. But we've got to overcome all of that, and we've got to work together because, as an example, within the integrated care board that I'm responsible for, and within our health system down in Kent and Medway, on any given day, Chris, there are between 400 and 500 people in our hospital beds who'd be better cared for somewhere else. Any of those people, not all of those people, are waiting to be transferred to residential care or nursing care environment. Some are waiting to go home, but they can't go home until grab rails are fitted to their bathroom or a ramp is fitted outside their home, and so on and so forth. So the need for us to work as a health system with our local authority colleagues who are responsible for social care, with the voluntary sector organisations, many of whom deliver that social care, you can start joining the dots up. And to add to the complexity, of course, we're all moving at different speeds with different challenges, both internally and externally. But meanwhile, that individual or many individuals are in hospital beds. They don't want to be there. We don't want them to be there because we have ambulances at the front door. So we need those beds. So the challenge for us is to really work across the system. And that comes back to trust and relationships. That comes back to humility, a fundamental trait of leadership, authenticity. So when I sit down with the leaders of our upper tier local authorities and district councils, they know that I'm not there to score points. I know they're not there to score points. We're in that room, around that table, be it real or virtual, to come up with new and different ways or make existing ways work better to benefit the communities we're all here to serve. We have one thing in common in Kent and Medway. We are collectively here to serve over 2 million people. That's it. I get quite exercised about this, and I can be I'm known as a bit of a disruptor, and I challenge, and I welcome being challenged. Because one of the things I learned as a very young chief executive, I don't know why, Chris, but in my head, I wanted to be a chief executive by the time I was 35. I don't know why, but I did.
Okay. Yeah.
and I became chief executive at 34 and 200 days or whatever it was. And then perhaps for 2 years, I got lost in the title.
Right. Yeah.
You know, when I arrived at my new office, on my desk were 2 or 3 boxes with business cards with my name and the title of managing director, which was the way they described the CEO's role. I don't know, I'm guessing there might well have been 200 business cards. I gave those business cards out to anyone that I could meet in the first 3 months, which is a nonsense. But I learned quite early on, and I was very, very fortunate to be supported by some very wise people who I guess these days will be described as mentors, although I didn't realize it at the time.
Yeah.
Who really helped me reframe my thinking about the role. And it wasn't just about, well, here's the title and I've got my own glossy office and all of that kind of stuff. The role of being a chief executive, being a leader, is much, much more than that. And it's a huge responsibility. And I know, Chris, that you and others at GameShift spend a lot of time talking about leaders, and I guess you'll see some commonality, some common traits amongst them all. And the more successful ones, the Jim Collins level 5 leaders and so on and so forth, will have some particular traits that they will show in their leadership on a good day and on a bad day.
Yeah. Cedi, I'm conscious that we're like 40 minutes in, but there's something I've got to ask you before we draw things to a close, which is, I know you're not done. So what next? What's the next edge for you, or what are you working towards?
I just committed myself to a further 3 years as chair of the Integrated Care Board, so my commitment to the NHS remains absolute. I will continue with my portfolio career, but in parallel, what I'm really, really hoping is that our health tech startup secures the funding, the investment it needs to go forward. We've been in a whole series of discussions with regional and national governments in a number of countries in Africa, for example, who are very interested in bringing our technology to their countries because they can see the benefits. My wife would like me to retire, but I genuinely can't see myself doing that. Thank goodness my health is reasonably good. Legacy of a long basketball career physically in terms of my joints, but generally speaking, I'm in good health. I can't see myself stopping anytime soon, Chris.
Yeah.
And what motivates me is making a positive difference.
Yeah, that's brilliant. I keep telling people that I'm semi-retired, and Claire keeps telling people, no, he's got 3 jobs. So we've often been kindred spirits, and I fear we may be kindred spirits in this one as well. I'm not stopping either. Cedi, let me say a couple of words to finish off the podcast for our listeners, and I'll come back to thank you properly. So everybody, thank you so much for taking the time to listen and watch this episode. There are so many connections as ever to other episodes. I do encourage you to have a look. I will try to put in the show notes for this one some of the connections I see. But in the meantime, Cedi, my old friend, you are an inspiration in so many ways. Thank you so much for coming on this one. It's been a real pleasure to see you.
It's been an absolute pleasure for me, Chris. And, as I said at the very beginning, I've learned so much from you and your work. So I can only thank you. And I'm so glad that you have no intention to slow down anytime soon. So thank you very much indeed.
Thank you, Cedi. Go well.